Hello, my name is Svetlana Pyatigorskaya. I am a family nurse practitioner and American board anti-aging health practitioner. And today I will present you a little video about the pain and a slightly different look at the pain and how we can manage that. So, why does pain feels worse at night? And the pain really does feel worse at night for many people. I have my patient asking me this question more than once. And because of that, I try to research is there real factors which is may make the pain worse at night. As a matter of fact, it's happened to be a lot of possibilities why hormonal changes, body clock, the change of inflammatory response. This all may affect the pain and how we feel after the dark. So let's look at some factor after the dawn pain. Your body has pain clock. This is one of the reasons why you have a pain. At night, after the sunset, the cortisol drops. It should drop. This is one of the mechanisms which is allow us to go to sleep. Cortisol drops, melatonin rise up. However, cortisol is the steroid. Steroid would control the inflammation in our body and suppresses it. When after the dark the cortisol drops, our inflammation may go up, and that just will increase our pain. In the same time, melatonin, which is supposed to put us to sleep and is a good thing in many situations, may be a factor why the pain feels worse for the people with autoimmune disease and the problem with immune system. Inflammation can have a nighttime rhythm. We have a certain inflammatory chemicals we call cytokines, and those cytokines is going up during the night and early morning. Finally, the poor sleep, the pain which is make a lot of people not sleep well. This insomnia is a factor which is may aggravate the pain next day. So today's bad sleep is lead to the pain tomorrow. At night, pain has less competition. This is quite easy. During the day, we distract with everything. We distract with work, we distract with household activity, we're reading the books, we're watching the movie. After the night falls, we stop all activity because we're going to bed, and now the pain is the focus, which is we see our brain see much more important than it was during the day. At night, we stop moving. This we stop moving, that just means the stiffness going up. So stiffness is another factor which is making pain worse at night. Finally, medications. A lot of people taking medications for pain on a daily basis. But unfortunately, it's not always being taken in the best time of the day. Like if your pain worse at night and you're taking medication in the morning, then by the time you need that medication may wear off. And sometimes the changing of timing, medication timing, may help you with a better, situation with the pain after the sunset. Finally, hormones can influence pain sensitivity, and hormones have fluctuation over 24-hour cycle. This especially can be better for the premenopausal, menopausal, thyroid disease problem people, migraines, pelvic pain, fibromyalgia-like pain, osteoarthritis, and muscle pain. We're all sensitive to hormones. Let's look the schedule day for the day of how the pain may be influenced by the daytime. So early morning between 4 a.m. and 8 a.m. cortisol rises, and that just means we have more protection from inflammation. Sympathetic tone rises. Inflammatory stiffness may be high because we sleep through the night and we were moving. So that just led us to morning stiffness, inflammatory arthritis pain, back stiffness, headache in some patients, especially for the patient who has a cervicogenic headache, the headache which has come from the changes in the spine. Late morning, 8 a.m. to 12 p.m., this is the time we're going to work. Cortisol still high, it protects us, movement increase, so we are working against the stiffness. Light suppresses melatonin, so that is autoimmune pain is kind of benefits from that. Many patients feels improvement in mobility and lower pain after warming up. Afternoon, 12 to 5 p.m. still be a good time in the pain clock. Body temperature alertness high, endogenous pain inhibitors stronger. And we have a better situation with pain at afternoon. Evening, 5 to 9 p.m., cortisol declines, fatigue accumulates, muscle overuse from a day. Melatonin begin raise after the dim light onset. Mechanical pain, myofascial pain, neuropathy, and fatigue-related pain may be increased. Melatonin high at night. So 9 to 3 a.m. melatonin high, cortisol low. All inflammation flare up. Fewer distraction. The concentration on the pain high. Body temperature drops. Cytokines activity, you remember cytokines, it's inflammatory chemicals, raise up. Immobility, we're in the bed, we don't move. This is probably the worst period for the pain. It's sharper, louder, neuropathy, arthritis, fibromyalgia, and restless leg. All is in flare during the 9 p.m. to 3 a.m. Late night, between 2 a.m. to 5 a.m. Lowest body temperature, prolonged immobility causing stiffness, sleep fragmentation, because the pain waking people up from sleep. Possible glucose drop, which is important for the people with diabetes. Burning neuropathy, cramps, inflammatory pain, insomnia, pain loop. That is what we have during that early morning hours. A little look on the different type of the pain and what is making them worse. Inflammatory arthritis, pain, night, early morning. Osteoarthritis, later of the day after activity. Neuropathy, evening, night. Fibromyalgia, variable. Migraine, early morning or triggered by sleep, light changes. Low back pain, morning stiffness, or end of the day flare. And finally, cancer. Cancer is unfortunately is often worse at night, the pain related to cancer. There is a certain ideas what we can do without much of medication use to improve our pain cycle. In the morning, we need 10 to 20 minutes outdoor morning light, ideally within 1 hour after waking up. Evening, light hygiene. 1-2 hours before you go to bed, the light must be dim. You should reduce blue light, and that is our favorite TV, computer, telephone, iPad, all of that blue light. Don't forget this. Pain timing daily. This can be helpful, especially if you want to regulate your medication timing. Taking track the pain every 3-4 hours for 7 to 14 days with sleep, meal, glucose, weather, stress, activity, medication, bowel function, and menstrual hormonal changes. And if you do that in the 2 weeks, you will have a pretty good idea Where is your pain? What is making it worse? What is associated with? And now you can take steps against it. Pre-sunset movement. So like before the sun set, you need a little more movement routine. Gentle mobility, stretching, warm shower, light walking, all of that will be positive on the pain control routine. Anti-inflammatory timing. Consider whatever prescribing anti-inflammatory neuropathic pain medication. Um, this is important. This is easy to do. Medication has one set, peak, and duration. And it's not necessary to be like immediately. It depends on your medication. But all this information is very easy to find. You just Google your medication, you have your one set peak duration. What you want to do, you want the peak of your pain being the same time with the peak of your medication onset, right? Like, for example, you notice what your pain was at 9 p.m. and you're taking medication which has a peak in 3 hours. So you have to take this medication at 6 p.m. to have a most pain relief potential. Sleep first plan. Treat insomnia. You remember, insomnia, if you don't sleep well today, you will have more pain tomorrow. And finally, reduce threat signaling, pain, neuroscience, education, breathing guidelines, all of that which is rooted in the psychotherapy and very popular. This is more and more popular, especially through the biohacking movement. All that can be used to control the pain. Let's look closer to the certain, like in my opinion, most noticeable pain factors. So low even cortisol increase nighttime pain. What is the traditional medicine says? Typical pattern, pain worse in the evening, night, early morning, stiffness on the walk-in, inflammatory arthritis, polymyalgia. Most effective convention option is to take NSAIDs. NSAIDs is a pharmacological group of pain medication which is we use as the first line. Tylenol, ibuprofen, diclofenac, Celebrex, all of it falls into the NSAIDs group. So taking NSAIDs with the time and consideration may be helpful. Along with NSAIDs, you have to remember about acetaminophen, Tylenol. This is a medication which has a least potential for anti-inflammatory effect. So it still helps you with your pain, but let's say compared to other options, it may not reduce your inflammation as well. Topical NSAIDs, well-known diclofenac or Voltaren gel. This could be used for a certain area of a pain, and sometimes the doctor may prescribe you low-dose corticosteroids. They are very effective. However, the long-term steroids may have a lot of side effects, which will override the benefit of this medication as a pain medication control. So that's when be prescribed in very, very critical situation. Let's see what does this functional medicine say about pain. And I have to tell you from the beginning, the functional medicine intervention will not work as fast as the traditional, like will not work as fast as the ibuprofen or Tylenol, right? Functional medicine intervention needs a long-term commitment before you start feeling the benefits of those supplements. So number one supplement, omega-3. We think about that omega-3 as cholesterol medication. However, it has a great anti-inflammatory potential, and in addition, it's protective to the brain. It's actually protective for the prevention of dementia. So omega-3 is important. Curcumin, turmeric, probably the most recommended anti-inflammatory medication. Once again, just remember, it will not be working immediately. You need to take it on the regular basis to have a benefit. Look at the recommended dose. It's a 500 to 1000 milligram standardized curcuminoids a day. Most likely you will want to have this information like available to review, and you actually can do that. I will put the slides, all of the presentation slide will be on my website in the blog, and my website is www.vitalityinvasivehealth.com. I will put that that website address at the first comment, so it will be easy to find. And I also have another very useful tool on my website. It's artificial intelligence label analyzer, which may help you to have independent opinion about the supplement which is you take. And then very easy, you just make a copy of your label, supplement label, put it into the analyzer, and you will have very, very detailed information. If you need help how to use it, you may look at my other video where I teach the people how to use that label analyzer. But continue. The next supplement what we may want to use for the pain is Boswellia. And once again, look at the doses. Another thing is a ginger extract, vitamin D, and I did not include it, but I find it very, very helpful for the pain. It's a black seed oil supplement. This one, black seed oil supplement, probably one of the most important, most effective supplement for pain, and really can concur with the insights during the pain control. Okay, biohacking lifestyle modification, chronotherapy, time anti-inflammatory interventions before the expected flare window. For example, if pain peak at 7-9 p.m., evening dosing of topical treatment before sunset may be more effective than the morning-only coverage. Anti-inflammatory evening routine, warm shower, gentle mobility, topical diclofenac, topical magnesia, or low glycemic dinner. Morning light exposure, we already talked about that, stabilizing cortisol, that just need to be sunlight. And unfortunately, many people don't have these benefits, but we have to try as much as we can. Next thing, raising melatonin, darkness, physiology, pain, louder after sunset, right? Topical pain pattern. The person says pain starts when it gets dark, pain is worse in the dark, pain feels scary, or pain improves with the light, TV, distraction. And this is another thing which is kind of you don't imagine, right? Because it sounds like your imagination, but it's not, it's real. Most effective conventional option, there is no medication especially for darkness, treated with the phenotype, neuropathic, inflammatory, musculoskeletal, anxiety related or insomnia related. Once again, the conventional medicine is now put your attention to the psychotherapy type of the thing, cognitive behavioral therapy, cognitive behavior therapy for insomnia, trauma-informed therapy, and all of that bunch what you may work with a specialist psychotherapist. What the functional medicine talks about that. We again talking about supplements, and we are back to melatonin, which should be used with caution for by the people who has autoimmune type of a pain, right? So common conservative starting dose 0.3 to 1 milligram, 1-2 hours before the bed. If not, we're going to want 3 milligram for insomnia. Selected patients, higher dose are not always better. Magnesium, just remember magnesium is important. It's a lot of based for magnesium for the nighttime pain. You can use magnesium glycinate or tauride, and its common dose is between 100 to 300 milligrams. should be used caution with the people with a kidney disease. L-theanine may be helpful. For the pain. Common usage range 100 to 200 milligram at evening, and glycine 2-3 milligram before the bed. Rise in melatonin darkness physiology pain. Biohackers recommendation: do not make the room complete dark too early if darkness itself triggers the treatment patient. You can use warm amber light, and the Hemocell lamp is one of the best options. Light schedule: bright outdoor light in the morning, dim warm light after the sunset. Avoid bright blue-white overhead light late evening. And it's now not just our computer, it's our lamp. Lots of people has a daylight lamp. They are not very good in that situation. Competing sensory output. Just put the music, audiobook, something which will distract you, because remember, the pain is worse when we concentrate on it. And safety: for the patient with post-traumatic stress disorders, falls, neuropathy, or fear or disability, use visible peripheral lighting, bed rails if needed, and non-slip floors to reassure that you're not falling. Nighttime cytokines, inflammatory chemicals, raise and immune activation. That is another important pathway of pain, right? Typical pattern: pain with stiffness, swelling, warm morning stiffness, fatigue, low-grade feverish feeling, autoimmune flares. Most effective conventional thing: do not treat only with supplement. If you have a rheumatoid arthritis, psoriasis arthritis, lupus, all of that group of autoimmune arthritis or gout, it will not be well responding to the supplements only. Again, in science, you remember Tylenol, ibuprofen, teclafenac, Celebrex may help. For the people with gout, you can diagnose through the blood work. It has elevated uric acid in the blood works. The medication choice is a calcine. Again, the steroids time, and some people may need the steroids, but as I said before, it should be really like situation where there is no other choice, and it's a doctor decision when you need the steroids. What the functional medicine offer you? Functional medicine offer you combination: curcumin, omega-3, vitamin D, right? Low dose naltrexone. Naltrexone is a medication which is initially was used as the opioid antagonist for the treating of opioid overdose. However, off-label use, it may be helping with fibromyalgia, centralized pain, and autoimmune pain selected patients. Common clinical range 1.5 to 4.5 milligrams at night. PIA, the supplement which is most recommended for neuropathic pain, and the neuropathic pain is a pain which is happened because of irritation of the nerves. Usually it represents as the burning, electrical shocks, and as a matter of fact, it can be any funny sensation which is hard to explain. Like I had a patient who had a neuropathic pain represented as a itchiness, as the cold sensation, as the feeling of a heavy legs. All of that may be related as neuropathic pain. So PIA is a choice for neuropathic pain. Quercetin is for the mast cell or histamine pattern pain. This is another interesting thing related to the allergic reaction. Mast cell histamine pattern, you can check yourself easily if you have anything like that. Just scratch yourself with a nail lightly, and if that scratch will go very inflamed, red, swollen within several seconds and does not disappear as it should in several seconds, you may have a problem with the mast cells, and you may talk to allergist about that and check with your doctor if you need any intervention for that. But if you have it, you may use that supplement in a range of 200 to 500 milligram twice a day. It's must be helpful for that type of a pain. Biohacking, again, anti-inflammatory dinner timing. Finish dinner 3 hours before bed. Avoid alcohol, high sugar meals, and large late meals. Heat versus cold test. Inflammatory swelling may respond to cold. Chronic stiffness may respond to heat. Basically, it's very easy. If you have a hot skin at the area of pain, put the cold. If you have a cold legs or other body part, put the heat. That is very easy. And finally, heart rate variability. It's another technique which is you may use with the trainer, the psychotherapist, who will teach you how to use it, the heart rate variability technique. Low body temperature, immobility, stiffness. Traditional medicine, typical pattern, pain after laying still, stiffness, walking better after the warming, worse cold weather, osteoarthritis, myofascial pain, fibromyalgia. This type of a pain you may be experiencing not just at night. This is pain has a very specific pattern. No matter what position you will be staying long enough, you will start pain. The position what was initially helping you to relieve the pain after a certain time will be position which is causing you pain, that you can identify that pain very easily. Most conventional option, again, sites, topical sites, muscle relaxant. Muscle relaxant is a group of medication which is helping to relax the muscle. One of the trick of that medication, they are, most of them, like all of them basically, one of more, one of less, is causing you sleepiness, which is making them difficult to use during the daytime for the people who work or study or, an active lifestyle. But if you have a significant muscle stiffness, you may try to take the muscle relaxant before the bed. It will improve your sleep, and it will improve the situation with your musculoskeletal pain. Physical therapy is foundation. The traditional medicine see the physical therapy as initial treatment method for the stiffness and that type musculoskeletal pain. What functional medicine offers us? Magnesioglycate and malate. You remember that we talked about the pain before, and it was a different, base magnesium. So for that type of pain, glycitate and malate. Muscle tension, cramp, fibromyalgia, leg pain. Tart cherry extract, it's a herbal supplement. You may use it. Creatine. Creatine is one of the very popular supplements. It's not an analgesic, but it may improve muscle function, especially for the people who is on the second half of life and start losing muscles to the sarcopenia. This could be a helpful supplement and a 3-5 gram a day, but be careful with the renal function. Check with your physician, do the blood work to know your renal function. Collagen peptide plus vitamin C in combination may be helpful for the pain. Biohacking lifestyle, pre-bed mobility, snack 5-10 minutes, gentle range of motion exercise, some stretching, shoulder rolls, like light gymnastic before going to the bed may be helpful. Heat therapy. The stiffness responds to the heat, but still remember, if you have a cold, you're doing with a heat. If you have a hot, you're going with a cold. Morning decompression, gentle stretching before standing, avoid jumping out of a bed, so slow waking up, stretching in the bed, enjoying the life, enjoying your morning, thanking for the waking up, which is a positive, optimistic life approach. Compression socks or leg elevation, that is effective for the people who has edema, swelling in the leg, and usually it's related to the poor circulation, so you may else consult your doctor about possibility to fix your circulation problem. Reduce distraction, increase attention to the pain. This sounds like very challenging because we've been told for falling asleep, turn off TV, turn off everything. But if you have significant influence of focusing on the pain after you go into bed, then it may be different. Use the distraction, use the TV, use the audio books, use the music, whatever is better for you. Again, work with a physical psychotherapist. You have a cognitive behavioral therapy or other therapy if it's appropriate. And we talk about possibility of using medication in CNRI group, which is antidepressant, such as duloxetine. But again, you cannot make the decision alone. You have to talk to your doctor and see if it's appropriate for you. What is the functional medicine says? It offers us several supplements which is maybe helpful in that situation, and it's L-ferritin, magnesia, glycine, saffron, ashwagandha. All of that may be good for the pain, and it's maybe good for many other body function. Biohacking, pain competing input, TENS unit, heat, vibration therapy, compression, music, guided meditation, breathing pacing. There is a technique, breathing technique. It's a 4-7-8 breathing, box breathing, which is shows promising things in those controlling of this type of pain. Evening brain occupation, that is what I started with. Audiobook, prayers, meditation, light hand activity, calm show, or family check-in before the pain peak, right? We have to overcome the pain with our mind. Neuropathic pain, which is worse at night. That's again burning, tingling, electrical shocks, crawling, numbing, anything which is feel funny may be related to neuropathic pain. First line neuropathic pain medication would be prescribed you by the doctor, probably maybe primary care, maybe neurologist, and it's again antidepressant, duloxetine, venlafaxine, anti-seizure medication, gabapentin, pregabapentin. I would say this is probably the first line, which is we see more and more being prescribed. So this is the medication options of traditional medicine for a neuropathic pain. You can also use a topical lidocaine, it's lidocaine cream, or the capsaicin cream itself may be helpful, and it's available for prescriptions. The functional medicine has a good focus on a neuropathic pain, and number one supplement for the neuropathic pain we offering is LA, alpha lipoic acid. You can take it as the supplement 300 to 600 milligram. It is else available as IV infusions. You can look at local center. The IV infusions ALA is very popular. I have them in my office. If you're interested and want to come to Brooklyn, you're welcome to come. We will do that infusion for you. Benfotiamine, useful for diabetic neuropathy pain, 150-300 milligram. Vitamin B12 in the form of methylcobalamin could be useful for pain. Um, for the B12, before you start using that, do the blood work. This supplement is useful only for the people with a low B12. If your B12 is normal or high, additional B12 may be harmful. There is not much talk about that to be harmful, but it can be harmful. So control it with the blood work and just use it if you truly need it. Acetyl L-carnitine, very good supplement, 500 to 1000 milligram twice a day. Pia, we already talked about Pia. Magnesia, we're talking about magnesia. And biohacking lifestyle. 10th unit, red light, food warming and safety. This is the most important recommendations in that situation from the point of the biohacking. Medication time and gap. Oh, that is, we already spoke a little bit about it. Typical medication pain returns 3-5 hours at 3-5 a.m. like early morning. In many cases, it's causing people waking up at this period of time to take an additional dose of medication. Additional medication which is longer working, like a gabapentin, pregabapentin, may be helpful. Duloxetine is maybe helpful. Once again, it's something which is need to be discussed with your doctor. Functional medicine offer you pretty much same say supplement. It's magnesia, pia, curcumin, omega glycine, but it's else recommend you time when in according to your pain patterns. Biohacking, pain clock daily. We're going back to the pain clock daily. We're off mapping, mark medication supplement timing, and onset and offset. That's again onset peak duration. You need to know your medication. You need to know when we're working and when we're off. Anxiety, depression, post-traumatic stress disorders, loneliness, and pain treat amplification. Typical pattern: pain worse at night, in a silence, when alone, during stress, after conflict, trauma, reminders, or fear or disability. And traditional medicine is lead you to the psychotherapy, lead you to the antidepressants, but it is important. It's very easy to move toward the Xanax, clonopin, sorry, what is relief anxiety very fast. However, they are highly addictive. They should be used with a great caution, and you should be avoiding that if it's possible. Talk to your doctor and try to find less dangerous medication to control your issue. Functional medicine offer you L-theanine, magnesia, saffron, omega-3, and there is a new thing, lavender oil oral preparation. Has evidence for anxiety in some trials, but product specific and not appropriate for everyone. So we find a good brand, don't take the bad brands. Check with my IE analyzer if your supplement is really good and what quality it has. Biohacking recommend as vagus nerve activation. This could be done with the hammering. It could be done with special devices which can be bought now. So that stimulating vagus nerve in this area may be helpful for controlling anxiety and anxiety-related pain. Guided imagery before sunset, important. The patient pain relief raises after dark. Social analgesia. Scheduling phone calls, group support, pet therapy, family check-in. So basically, don't be alone. Have a support, have a friends, have a social support around you. This is conservative starting structure for many chronic pain patient adjustment warning diagnosis medical list. Basically, it's a recommended schedule what you can do every day to improve your pain sensation. Outdoor in the morning, 30 minutes, 10 to 30 minutes, protein forward breakfast, gentle mobility, 5-10 minutes in the morning, review glucose if diabetic, pre-diabetic, take anti-inflammatory supplements with the food if appropriate, it is in the morning. In afternoon, movement snack or PT exercise. Movement snacks mean you have a little gymnastic, even like with yourself, 5-10 minutes of movement can be helpful. Hydration, electrolytes, avoid overexertion what causes evening crash. Before sunset, apply topical treatment if there is a localized pain. Warm shower or heat therapy. Gentle stretching. Take evening pain medication or supplement is covered to the predictable flare window. Evening, dim light, warm light. You remember that Himalayan salt lamp. Not total darkness. If darkness worsens your symptoms, have some light source when you sleep. Low glycemic dinner, no alcohol, sleep of pain flares. Magnesia, glycine, L-13 if appropriate. Tense music, breathing, prayer, meditation, guided relaxation. In the bedtime, room should be cold, body warm. Safety lighting if fear of fall. Trick if you have a neuropathy, if you have a cold, you don't forget you may have a heating pad or heating blanket, which is sometimes may resolve your problem. And finally, high yield intervention by mechanism. You can look at this. Most of them we already discussed. Once again, to have this information to review that in your leisure time, get the slides from a website. It's www.vitalityinvasihealth.com. You go to the blog and you should find those slides in my blog. Your pain is real, but it's not the end of the story. You can do a lot to improve your pain. Even when the pain feels overwhelming, there is still a new path to relieve it, better function, and the future fuller of life. Stay curious, stay hopeful. There are often alternative approach and a personalized solution worth exploring. You deserve care would look at the whole picture, not just the pain. Find the provider who care about you in whole, who knows not just the traditional medicine, but the alternative medicine and may help you to develop the best plan to manage your pain for you. And again, my name is Svetlana Fiatigorskaya. I'm family nurse practitioner and anti-aging board certified practitioner. I practice in Brooklyn, New York. This is my address. Where is my phone? And you can scan that screen to go straight to my website. I accept a new patient. If you want to become my patient and have a caring provider, you're welcome to call and schedule your first appointment. Be healthy, be painless. That's all.